So there's three large groups of people that are at risk. So the young, generally those who are less than 2 years old, that'll have a more difficult time regulating their body temperature. And then people who are older, generally over 65, may have a more difficult time regulating their body temperature and can get into trouble faster than the adults and young children in between. The other group that's at risk are people with certain medical conditions. And it's important that people should ask their doctor, who's actually taking care of them, prescribing their medications, to understand if they are at risk. But thinking about some generalities, people who are taking medications for behavioral health problems may have some difficulty regulating their body heat and may be at increased risk. And there's one other group, a medical group, that is important for consideration. And those are people that may have kidney or congestive heart failure problems. Because one of our most important defenses for the heat is sweat, and that will make us dehydrated. We need to drink more water. And so it's one thing to tell a young, healthy person, drink plenty of water and stay hydrated. But someone who has heart failure may not be able to balance their fluids that effectively. And someone who may have kidney problems also may be on fluid restrictions. And so it's really important to understand your own health problems, discuss those with your doctor, and understand if you can liberalize fluid intake during a heat wave, or if you're someone that really should just plan to spend the next several days indoors streaming some fun TV shows. So when we think about medications that can put people at higher risk, some antidepressant medications, other medications used to treat things like psychosis, bipolar disorder, may have some effects on the brain chemistry that can also affect the way that we regulate our temperatures. That is not across the board. And again, it's important for people to speak to their individual physician about their risk from their medications. But it's something that I think is important to consider, so that people are aware that they may be at higher risk. When this is a really good time to look out for your neighbors, and to look out for each other. There are people who may have cognitive problems that have a harder time recognizing their response to the heat. They may be slow to recognize that their temperature is rising and that they are becoming ill from the heat. So if you have friends or family or neighbors that may fit that description, whether it's from a developmental problem or if it's something related to dementia or older age, it's really important to look in on those people and make sure that they're doing well. Getting them into an air-conditioned environment, taking them to a community center or some other place with support that's cool, that can help protect them during those hottest hours of the day, is going to be really important in the next several days.